My name is Roy. I'm originally from Israel. I live in Vienna, Austria, and I'm here as the patient devil's advocate. I know that us in tech look at healthcare and we see only places that can we improve, do better. But a lot of times we have a huge blind spot because when we come to fix problems with tech, more than often I see that we forget the end user. And sometimes we develop it for the medical professionals, but in any case in healthcare, the end user is always the patient, even if it's B2B to C. And I, as a chronic entrepreneur, but firstly, chronically ill patient, have a bit of a different vision about how do I see the future of patient-centric healthcare. I started my journey as a clinician, actually. I was a paramedic before. And when I looked at doctors, all I see was angels in white. It's a saying we have in Hebrew. And I thought that these people are almost holy. I didn't see them for the humans that they are, for better or worse. I thought that healthcare is doing a great job because you grew up knowing that you have coverage, which is universal, it's free. I can go to the doctor, I don't have to pay anything. I thought things are working fine. But this notion was shattered the moment I became a user of our healthcare system, which is considered one of the best in the world, by the way. And as I went from being somebody with a white coat to somebody wearing the patient pajama, my heart was broken to the fact that I realized that something is severely wrong with our healthcare today. I'm afraid my story started 20 years ago, but until today, with all the tech around us, we face with the same challenges as patients. The first moment that I realized something is completely wrong was the first time I had to go to an emergency room. I wasn't feeling well. I knew for a few months something is wrong with me. And when I got there, I realized that the people who are supposed to care for me and my life is being charged by their hands are actually overburdened, overworked, underslept. And what I felt as a patient, that there was a chaos around me. My first night in an emergency room almost ended up in me dying, basically, because of a medication error. This was the first moment, but then I thought, yeah, I know what it's like to not be able to sleep at night. It must be getting better. But when I was admitted to the hospital and realized that the people who are supposed to care for me are completely burned out, then I realized something is wrong. When a young doctor was trying to set an infusion catheter in my hand and was so burdened because she had a sick child at home and her hands were shaking because she hadn't slept for 20 hours. And then somebody called her and said there is an urgent case in the next room. I was wearing not a patient pajama. These small things are what affect the patient experience. I refused to do it. So I had a hoodie on. And in this hoodie, I had an insignia of the Israeli Red Cross, where I served as a medic. And it was the only point of compassion between us because she said, you're kind of a colleague to me. But then when she had to rush out, she told me the sentence that took this little fractured heart I have and broke it into pieces. She told me, you're a medic, deal with it. While the needle was halfway in my vein, she just left it there for me to bleed. And I had to decide if I pull it out or in. I finished what I had to do, almost fainting in the moment because you're not supposed to put a needle inside of yourself. I'm sorry if it's triggering anybody, but the moment was not only full of pain and ended up with a bloody hoodie, it ended up also with me realizing that a revolution is needed. I spent 7 years in bed without diagnosis. 7 years. In those 7 years, I went from a very, very healthy young guy to being bedridden, to being not able to shower myself, to walk myself, and eventually almost to talk myself. I could only say a few words before fainting. Every movement of my head would lead to fainting. And in this journey, I felt so alone that it doesn't matter that once in a month or so I saw a doctor, because every time I did, I was gaslighted, ignored, and mistreated, not because of any meanness, but because doctors have only, in Israel at least, around 10 minutes for each patient, in some cases even 5. And as far as I know, most universal healthcare systems are the same. I suffer from something called POTS syndrome. It's a failure of the autonomic nervous system. It means that everything that I can control, like moving my hands, walking, everything like this, was quite okay to a point, but everything that my body controlled by itself, breathing, sweating, digestion, blood pressure, it was so disrupted. An illness like mine was not that rare at the time, and I'm afraid that now it's 5% of every person with long COVID will have POTS syndrome. You need to understand, we are facing an epidemic of chronic illness, which means that together with this, and separately, we are facing an epidemic of mental illness. And still, we don't have access to the basic services that we need. When I come and start my new optimized patient journey, I want to be able to have everything that I need before I even need to see a doctor. I want healthcare to focus 50% of its efforts and budgets in prevention, first of all. And only then we treat whatever is acute. I know this vision sounds a bit strange at the moment, but think about it, that half of the diseases we're treating in hospitals are preventable. There are even data showing that it's much more than half, but I'll be kind of conservative here. If I'm not able as a patient to even schedule my appointment, right? I heard last week your national portal collapsed, right? This is just a technical issue. But what about people with disabilities, elderly, and so on? The accessibility for healthcare services is not as great as it should be. And when we have the interactions with doctors, what we see a lot of time is more like a battlefield than a collaboration. Instead of me being afraid of seeing a doctor because I'm so used to being treated in a poorly way, why can't we make it a partnership of sort? Why can't I bring my insights and my learning as an expert with living experience to the doctor office? And in the meantime, doctors, instead of being busy typing, can be busy discussing my health. I always say in my talks that I remember a lot of eyebrows typing above screens, but I don't remember a lot of doctors' faces, because we still don't have this human connection done. An optimized journey like this should never include patients doing DIY, do-it-yourself medicine. I got a text message in a DM in one of the social media networks last week from a patient in the US that didn't have health insurance. She's 25 years old. She had a chronic condition in her bladder, and she was begging to see a doctor. But even when she found a way to see a doctor in terms of money, she was so severely gaslighted that she had to basically do her own operation at home with the hope that now that she cut enough, the doctors will have to complete it. And that's what happened. We live in a world that the richest, strongest country in the world cannot provide basic healthcare to its citizens. We are here in Europe in a much better reality, but we're talking about technology in order to optimize the patient journey. But it took me 7 years, and eventually I was self-diagnosed. I had to study medicine from my own bed. I had to convince doctors that I do have an illness and it's not all in my head. And when I did, no hospital wanted to treat me because they didn't know what to do with this rare illness. So I had to rehabilitate myself. I had to learn how to walk and to teach myself how to talk when I was 27 years old. The first week that the GPT-3 was out, I made a little experiment. And I was afraid to do this experiment because I knew it's going to break my heart. And I just did something very simple. Not prompting engineering, nothing that I Googled how to do it. I just say, hey, like it's a friend. I have a friend, he's a male, 25 years old, from Israel. He feels 1, 2, 3, 4, 5, 6, 7. Can you give any differential diagnosis to him? This is the methodology doctors are using to diagnose. And I thought it's going to bring a long list of illnesses, and then maybe one of them could lead me to the next round of iterations. But the answer surprised even me. The answer was, I'm not a doctor, but I believe your friend is suffering from POTS syndrome. It took 20 seconds. I wasted all of my 20s in bed. The funny thing is, I cannot blame the time machine that I didn't have ChatGPT back then. The problem was not the technology. The problem was that nobody listened to my story enough to make this very simple diagnosis. I see a future in which patients and doctors are collaborating. I see a future in which patient education is an emphasis in the system. I see a future in which digital tools are being prescribed to patients because we're drowning in a sea of solutions, and it's very hard for us to understand what is validated, what is good for us. I see a future in which patient voices are not only being taken care of by sending a survey, but creating a true patient leadership and collaboration. I want to see patients in residence programs, that patients are an active part of every journey. And mainly, I want to see compassion and I want to see empathy restored to healthcare by changing the training schemes for both healthcare professionals and patients. I want to see in every organization of such a patient school or a patient academy. And I want to see the doctors to be being trained in empathy, because eventually this is the basis for a real patient-centric healthcare system. Thank you so much.